A total of 75 persons have entered Guyana from countries which have confirmed cases of the novel coronavirus since January 18th. Of that amount, there are 26 persons who remain under surveillance, while 48 were cleared of the virus. This was reported by Chief Medical Officer Dr. Shamdev Prasad in an interview with the newsroom on Tuesday, where he noted that those persons being monitored are isolated in their homes as this reduces their contact with other citizens.
They're at home in isolation. Well, we usually would see to them at the screening what the measures are, and most people have readily accepted. There are a few persons who, for example, who came in for short period of time, like they're here for a short period, or they're in transit through to some other countries, from especially some of these new countries that we have added on to the list. All right, not necessarily the Chinese national or the persons coming from China. Those persons will attend to their matter, whatever it is, and they either depart or stay around. But so far we've had these 26 persons that we are in contact with, and they're advised to check their temperature. Most of them are traveling with a thermometer, and they can report on any symptoms or sign that they might be experiencing.
The ministry in January implemented a system whereby persons traveling from or through affected countries have to be isolated for 14 days, as this is the time taken for the symptoms to be visible. This may be done at home, or if flu-like symptoms are noticed, it will be done at a health facility. Dr. Prasad is confident that the systems put in place for increased screening at ports of entry will protect against the importation of the virus.
So far, for the last 6 weeks, we have our systems in place to screen all of the regular formal ports. But we have extended some of that to some of the other areas of entry. We can't monitor some of the open borders between Brazil and Venezuela, but we have alerted our health services.
The novel coronavirus, referred to as COVID-19, originated in Wuhan, China in December 2019 and has since spread to 104 countries around the world. Since its origination, the cases in China have significantly decreased, but cases outside of that country is now more than 111,000, with about 3,890 deaths. The World Health Organization has warned that the virus can become a pandemic, and several countries have implemented travel restrictions. However, Guyana's chief medical officer said any travel restrictions to be instituted in Guyana will have to come from a cabinet decision. Due to the current election stalemate, it can be several weeks before a cabinet is in place to make such a call. The Ministry of Public Health in its last statement had disclosed that the Georgetown Public Hospital, the Diamond, West Demerara, and 7 private hospitals have the capacity to isolate suspected cases until a diagnosis can be confirmed. Reporting for the newsroom, Bibi Katoon.